Well, I think the responder rate speaks for itself that, nearly after 12 months, nearly 80% of patients that were on the patch increased their eliciting dose by at least one dose compared to only about 48% in the placebo group. And approximately 60% of those increased by two or more doses, which is significant for patients because the main purpose of this therapy is to desensitize patients and protect them from allergic reactions. So by increasing that eliciting dose in the majority of patients, we feel that this should help protect patients from allergic reactions due to accidental exposures, either having no allergic reactions or hopefully having a much less severe reaction by being on the therapy. Well, when you look at the response rate, you had to get to a certain dose of peanut based on where you reacted at the baseline challenge. So you either had to get to about one to two peanuts an eliciting dose. So that protection, is significant for most patients because most patients react at probably less than, 30 to 100 milligrams. So again, I think when you look at the treatment effect in the younger patient population, the 1 to 3 year olds, it was a little more significant, but that's pretty consistent with studies across the board that the younger you start these therapies, 1 to 3, they're going to do a little bit better than the 4 to 7 year olds. And that's shown with OIT, oral immunotherapy, and sublingual immunotherapy as well, that remission rates and other things can be higher the younger you start the therapy. So it's important, I think, to also emphasize that we want to start these patients on at an early age. This was the 4 to 7 year old study, but as you mentioned, the 1 to 3 year old study that was published now several years ago showed consistent effects as well, but even a better effect the younger you are. Sure. I think the biggest thing that from the epicutaneous immunotherapy with the VIASKIN peanut is the safety of it. It's the safety of the study showed consistent findings that we've seen across all studies. The rate of anaphylaxis is very low in the 1 to 2% range. Reactions do happen on the skin because you're applying an allergen to the skin, but most of those patients were able to stay on therapy even if you had significant reactions. So the dropout rate is very low in this study. The compliance rate is very high because it's very easy to do. So I think from a safety standpoint, we saw no different safety signals than we've seen in any of the other studies, that it proves to be a very safe and effective therapy. I mean, the advantages of this therapy are compared to other therapies like oral immunotherapy, is the practicality of it, I think, is the also part. So while safety is high, the practicality of this is quite easy, where patients don't have to come for up doses. There's no effect on illness where you have to hold the dose like with oral immunotherapy with illness, exercise, things like that. So it's a very practical and easy and very safe, effective treatment for patients. No, when they looked across the subgroup analysis, whether they looked at the intention to treat per protocol or complete analysis set, there really was no difference. And when you looked at the different eliciting doses, there really was not a significant treatment effect difference. So it seemed to work quite well across all the groups and all the sensitivity analysis that they did. So I truly believe that this product is safe and effective. And the good thing is that this puts us on its path to hopefully FDA approval sometime next year. Yeah, so the long-term outcomes, we expect to we'll follow these patients with an open label extension. We'll continue to challenge them over time. We'll also look for what's called sustained unresponsiveness, which is where you're looking for a sustained effect when you come off therapy to make sure it's a more permanent, durable effect. So we'll follow these patients for several more years to make sure. And what we've seen in the previous studies, when you look at the open label extensions, whether it's Epitope or Papete's Epopex, the the results are that you continue to show desensitization over time. So you have to be a little patient with this product because you are using such a low dose, 1/1000th of a peanut. So over a year, you're only getting exposed to one peanut. But when you look at the open label extension studies, some of those patients got to, 15, 20 peanuts after several years of just being exposed to 1 to 2 peanuts of the skin. So we see continued effect with this. So it's something that patients will hopefully continue to use over time to continue to improve their desensitization. And it's something that will fit easily into practice. Now, when you mentioned pediatricians doing this, I don't think pediatrician's office will be putting on the patch are doing this, but we definitely want them to refer those patients to us early because, again, the earlier we start these therapies, the better. But this is a very safe and convenient therapy for patients to do without updosing, without all the rules of oral immunotherapy and other things. So it's very convenient and obviously very safe.